Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Guillain-Barre syndrome. The Guillain-Barre syndrome is an acute demyelinating disorder affecting the motor neuron, resulting in ascending weakness that can lead to death from failure of respiratory muscles within days of onset of symptom. So, Guillain-Barre syndrome, also we can call it Guillain-Barre syndrome. Okay, so it affects the motor axons. In this disease, the myelin around the axon is lost or destroyed, and there will be ascending paralysis, and death may occur due to respiratory failure, due to paralysis of the respiratory muscle, maybe due to other reasons, okay, like pulmonary embolism. This may happen very quickly within days of onset of symptom. Guillain-Barre syndrome is an autoimmune disease of peripheral nervous system. It is not a disease of the brain and spinal cord. It is a disease of the spinal nerve roots and the spinal nerves. Guillain-Barre syndrome appears to be triggered by infections like Campylobacter jejuni, Epstein-Barr virus, cytomegalovirus, HIV, and by Zika virus, and many other viruses. So these are a few organisms. Exact mechanism, exact cause of Guillain-Barre syndrome is not known. There is mononuclear cell infiltrate to the nerve root and proximal nerve segment. Mononuclear cell infiltrates means that we'll get a lot of lymphocyte and the macrophages in the nerve root and to the proximal nerve segment. Okay, both the cell-mediated or humoral immunity are believed to be involved in the pathogenesis. So suppose T cell attempt to kill this bacteria, to kill these viruses, but it also mistakenly damages the myelin of the axon of the motor neurons, may also involve sometimes the sensory neurons. Or it may be humoral immunity from something is released from the B lymphocyte that may also do the same, may damage these bacteria and viruses, but they also damage the myelin sheath mistakenly. So we call it autoimmune mechanism. Okay, what are the clinical features of Guillain-Barre syndrome? Acute progressive symmetric ascending neuropathy. So this is symmetric. So not one limb, both limbs will be affected. Ascending neuropathy. From the lower part of the leg, it will go up to the head and neck area, to the cranial nerves. From the neck, from the leg, it will go to the thigh, go to the pelvis, to the abdomen, to the thorax, then go to the head and neck. Okay, there will be paresthesia, hyporeflexia, and pain. So you may lose the deep tendon reflexes like that of the knee jerk reflexes. Muscle weakness leads to immobilization, and due to immobilization, you may have pulmonary embolism, or muscle weakness just damage the respiratory muscle like that of the diaphragm. There is a chief muscle of respiration. So if the diaphragm is paralyzed, then person may die due to lack of respiration. Autonomic instability, there may be hypertension or hypotension, tachycardia or bradycardia. There may be excessive sweating or dryness. It is instability, autonomic. History of respiratory and gastrointestinal infection. There may be history of vaccination. Some vaccine, it is also blamed that on very rare occasion may lead to Guillain-Barre syndrome. Progressive weakness of more than one limb, mild sensory involvement, but there may be pain possible on the skin as well as in the muscle, especially where there is pressure on the pathological nerves. Involvement of cranial nerve, all cranial nerves may be involved, but usually olfactory optic nerve is not involved, and most commonly involved nerve is the facial nerve. It is bilateral involvement, and if this happens, that indicates something going to be very grave or outcome may be very bad. Okay, we look at these two images that I picked up from Microsoft PowerPoint Creative Commons online picture. This is self-explanatory here. Guillain-Barre syndrome, acute inflammatory demyelinating polyneuropathy. Okay, so this is acute condition. It involves multiple neurons. Paresthesia in the hand and feet. Most cases are preceded by an infection such as Campylobacter jejuni. Maybe any other cause of diarrhea may also cause that problem. Okay, or it may be viral infection like Epstein-Barr virus, HIV virus, the rotavirus, maybe the Zika virus. Okay, so maybe the other viruses, any other viruses like cytomegalovirus may also cause Guillain-Barre syndrome. Okay, what happened? Absent or dispersed deep tendon reflex like knee jerk reflex is lost. Okay, what happened? There will be diaphragm paralysis. The person cannot breathe. If person need ventilatory support, even they need tracheostomy. Treatment, main modality of treatment is modifying therapy for Guillain-Barre syndrome or plasma exchange. We call it plasmapheresis, so that we can get rid of the antibodies. We can give new fresh plasma without antibodies, and also injection of immunoglobulin that also help to reverse the course of Guillain-Barre syndrome. Here in this image we are seeing tingling and weakness in the extremities are usually the first symptom here. It may progress within weeks or days. Then a person may not walk, may go to the hospital. Difficulty of swallowing because of the cranial nerve damage and as a whole muscular weakness. Shortness of breath because the diaphragm is not working nicely. The accessory muscles of respiration are also not working here. Then there will be flaccid paralysis, that is the lower motor neuron paralysis or lower motor neuron lesion. Here is the axons. These are the myelin, yellow stuff that is destroyed in case of Guillain-Barre syndrome. This is the normal myelin, this is the nodes of brain here. If this is destroyed, then the solitary movement of the nerve conduction will be lost here. Guillain-Barre syndrome is a rare disorder in which the body's immune system attacks one's own nerve myelin, like this in Guillain-Barre syndrome. So what are the workup or investigative studies? Two important points. One is cerebrospinal fluid. What we look at that? Increased protein concentration, maybe 100 to 400 milligram %, but normal cell count, maybe 0 to 5 lymphocyte. Okay, we call it albuminocytological dissociation. Protein is albumin, it will be very high, but the cell will not be high, maybe 5 or 10 lymphocyte. Okay, this may not be found in the initial week, it may take time. Like that, EMG nerve conduction study, initial 2 or 3 days you may not get positive result, but if we continue that, reveals marked slowing of the motor and sensory conduction velocity or evidence of demyelination and axonal loss. Okay, this is electromyography, the nerve conduction study. Nerve conduction is not possible because the myelin is lost. So what is the treatment of Guillain-Barre syndrome or Guillain-Barre syndrome. Most important treatment is supportive therapy. Person should be in the hospital. If he needs respiratory support, person may get ventilatory support. Even they may need tracheostomy. If they cannot eat, then we may put one gastrostomy tube to the stomach. Okay, so nursing should be good. So person cannot move properly, so there may be chance of bad sore. So the patient or person should be moved side to side, and the bed sheet should be very nice and without any folds. Okay, so here plasmapheresis, exchange plasma. So the bad plasma will go out with the antibody, will get new plasma. Intravenous immunoglobulin, that also work. These two are not additive, but both of them work. Prognosis, this is a self-limiting disease and improvement occur over weeks or months. About 70 to 75% patient recover completely. 25% are left with mild neurologic deficits. 5% die. And that's all about the Guillain-Barre syndrome or Guillain-Barre syndrome. If you have any question, please feel free to ask me. Please share the information with your friends and please support my channel. Please subscribe me and have a nice day. Bye now.